Hello, I'm Dr. Wendy Johnston, here to share my team's poster, More Than a Patient Advocacy Organization, Patient-Centered Perspectives of Nonprofit ALS MND Health Charities. Nonprofit ALS MND Health Charities provide important support to people with ALS and family caregivers. In fact, referral to an ALS MND health charity is recommended in professional practice guidelines developed by panels of experts. However, patient-centered outcomes from these referrals and from interaction with these organizations has not been empirically established. Drawing on data from the Canadian ALS Talk project, we analyzed the ways in which Canadian ALS MND health charities influence the experience with people living with ALS and family caregivers. Details about our methods are on the poster, but based on input from 78 participants in 7 focus groups, we investigated the question: is there empirical evidence to support practice recommendations for referral of patients and families to ALS societies? We identified 3 themes. First, the ALS societies in Canada are viewed by people affected by ALS as part of the healthcare system. This was characterized by the way people talked about the ALS societies and multidisciplinary clinics as a single unit. Further, ALS MND health charities were described as health system navigators. They helped people find the supports they needed within the healthcare system. And also, participants looked to the societies to fill perceived gaps in the medical system. The second primary theme was practical and emotional support. The ALS MND health charities' supportive services were critical to day-to-day life. For example, peer support groups and the equipment loan programs. ALS MND health charities were also critical information providers. Participants trusted and relied on the comprehensive real-life information provided through the societies. And they valued the personal connections and understanding provided by ALS MND health charity personnel. The third and final theme was identified related to research. Participants looked for the ALS MND health charities for information that would facilitate their understanding of research and emerging therapies. They also wanted the ALS MND health charities to provide information about valid clinical trial opportunities. Finally, participants saw value in the fundraising that the ALS MND health charities do, particularly fundraising to support research, and they believe that ALS MND health charities should advocate for expedited approval of therapies. This investigation provides evidence that supports current practice guidelines. Healthcare providers should be familiar with what ALS MND health charities offer, and they should encourage people with ALS to access this valuable support early in their ALS journey. Our findings also have implications for policy. Healthcare clinics and systems should develop care pathways that explicitly include referral to ALS MND health charities. And finally, government should support ALS MND health charities. These organizations play a central role in the provision of care for people affected by ALS. Take a look at our poster to learn a little bit more.